Hello, Social Work 585. I'm Tim Brown, and this is an overview of my project, my needs assessment project, meeting the needs of female intimate partner violence victims, a qualitative needs analysis. Intimate partner violence, or IPV, is worthy of study for several reasons. One, it's widespread. Two, it has significant impacts on its victims. And the third is the relationship between oppression and IPV. Oppressed social groups such as women of color, women of low socioeconomic status, women with disabilities, and women with mental illness are disproportionately more likely to suffer from IPV. So there's also a social justice component to it as well, besides meeting the needs of victims through direct services. This is a breakdown of the participants and their roles within the agencies, as you can see below. The participants consisted of 9 women with work experience varying from less than a year to more than 20 years of service at the agency. And these women were all staff members at agencies serving IPV victims in Northern California. And the variance between among work experience and position sort of created a diverse sample pool for the purposes of the research. On this slide, you can see some of the questions which were given to participants. These questions were all conducted over the phone in phone interviews. And all these questions were formulated to shine light on the overall research question, which was, what services exist to meet the needs of IPV victims in Northern California? There were 3 key findings that emerged in the analysis of the qualitative data obtained. These were as follows: importance of a holistic approach in meeting IPV victims' needs, speaking victims' language through culturally competent practice, and the influence of the ongoing COVID-19 pandemic on agency services. The first theme, the importance of a holistic approach in practice, discusses the ways that the many diverse needs of IPV victims can be met through appropriate case management. IPV victims present with a number of diverse needs, whether that's crisis support, hospital services, housing, healthcare, mental health care, physical health care, legal services, restraining orders, custody battles, employment, and of course, ongoing social support. It's important for social workers who might be employed at these agencies to develop their case management skills so they can coordinate a number of different professionals in providing the best services that meet all of IPV victims' needs. The second theme was the use of culturally competent practice and more specifically appropriate language. Obviously, all victims of all walks of life and all ethnicities are impacted by intimate partner violence, and key to building that trusting relationship between practitioner and client is having the practitioner being able to speak and understand the client's language. So for this reason, the shelters tend to have multilingual and bilingual staff members, and if for some reason there is no staff member who speaks client's languages, they might be referred out so that a client can speak, that a practitioner can speak their language, and hopefully the best outcomes can be seen in that way. And finally, the impact of the COVID-19 pandemic. At least 5 of the 6 of the participants we spoke to who are involved in direct services to clients as opposed to like financial services have mentioned that there's an increase in the number of requests for services, particularly in crisis support services. This small sample in the qualitative research sort of mirrors the trends that have been observed across the world. And besides the impact of increased victim intake, there's also the reduction of agency staff members that are operating at reduced capacity. A lot of things like support groups and therapy groups have either gone online or been postponed. So this influences the degree of services that victims receive, which is definitely a concern going forward. 3 follow-up recommendations include expanding access to virtual services, sort of those Zoom, teletherapy, and that sort of thing. Obviously, we've mentioned the importance of case management skills and sort of coordinating services for victims and partnering with advocacy groups. At least 3 of the research participants mentioned the importance of expanding services to meet the needs. These facilities are not large. They have about 11 to 16 transitional housing beds. And in a time of increased service demand, it's important that we maintain adequate funding of these very crucial services. The the findings will be shared via email, follow-up phone calls, and Zoom meetings if so desired, depending on participant comfortable what works for the participants and their scheduling. There are some strengths of this study. One, the study sample was highly diverse. The participants had varying years of experience in various positions, from CEO to employment, advocate, legal services, outreach, and the agencies themselves were quite diverse. Some were in rural areas, some were in urban areas, some were large, some were small, some were in. They were spread across various counties in Northern California. And this sort of provides a broader perspective on the services offered in this region of California. Some study limitations include qualitative research. Obviously, we can't generalize these findings to other agencies or other agency staff members. Convenience sampling, generally the first person who answered the phone was who was interviewed. And external factors, at least one participant had to cut short our interview due to client presenting for services. Finally, last but not least, there may be limitations over the phone. Perhaps participants may be hesitant to reveal some aspects of service due to reduced comfort level from the phone, and that is also a factor as well. On this slide, you can see sort of the future research directions. One possible qualitative study that could be conducted as follow-up is looking at from the other side of the coin, or victims' perspective. Perhaps what services are helpful, what services could be improved, and what's one service that is not offered but could be offered to better improve outcomes for victims. Self-care is an issue, obviously working with victims who have experienced traumatic events. Secondary trauma, compassion fatigue, and burnout are a real risk. So it's important for agency staff to have good self-care plans. And finally, does matching a practitioner and client ethnicity lead to improved outcomes for IPV victims? Some professional development and reflection. This has taught me about local shelters in my area. Perhaps if a therapy client discloses to me that she's experiencing IPV, I now know agencies I can refer them to. This highlights the importance of case management, as I've already discussed. And of course, training programs, what it takes to become an advocate if I ever wanted to go down that route. And finally, the importance of macro practice. It's always better to prevent a problem like IPV rather than addressing it after it's occurred. These are my references. You can take a look at over these for more reading. And finally, I would like to acknowledge the participants from the respective agencies and the support they provided. These participants were very open, and I deeply appreciate their assistance in this research project. Thank you, and I hope you had a good semester.